I broke my leg and had to get admitted to the hospital. I was in traction and they said I would have surgery as soon as the swelling went down. I just had an IV in my arm for pain medicine. They kept the fluid going at a really slow pace with my pain medicine pump, my PCA. That bag of fluids that was hung up lasted a really long time. They hung it up when I first came to the hospital. When I got transferred to the ICU, well, they hung new bags. Now I have a central line. My IV site from before got infected. I told them it hurt, but they just kept giving me heating pads for it and said they would change it when it was due. The doctor said now I have a blood infection that probably started at my IV. My husband's doctor told him today that he has high blood pressure. He also told him he would need to start taking some medication to help control it. Bill's been in the hospital for a few days because he was having frequent headaches. The doctor told us the headaches were probably being caused by the high blood pressure. We both heard the doctor tell the nurse to give my husband a medication called Inderal for his blood pressure. The nurse never repeated the name of the medication back to the doctor, but she shook her head and said okay. When she came back to the room a few hours later, she handed Bill a pill that she said was the one his doctor ordered earlier. She said the pill was called Adderall. Bill and I looked at one another because we both heard the doctor say Inderal was the medicine he was prescribing for his high blood pressure. We both also remembered that our nephew takes Adderall for ADHD. So we both asked the nurse to check with the doctor again to confirm the correct drug. The nurse came back an hour later and told Billy was right. The doctor ordered Inderal, but she thought he'd ordered Adderall. She apologized to Bill for the confusion.
My dad was in the hospital recently for surgery. He was on a very busy medical surgical floor. My dad was in bed A, which was by the door, and his roommate Dan was in bed B by the window. My dad is allergic to penicillin, but was given an antibiotic with penicillin while I was downstairs getting dinner in the cafeteria. When I came back to his room, I noticed he kept scratching his skin. He said he felt itchy, and I could see a red rash on his upper chest. Soon, my dad started saying his throat was tight, and he was even having trouble breathing. I called the nurse. Several staff came rushing in and put a monitor on him and started giving him medications in his IV. Dad's okay, but we found out that he was giving his roommate Dan's medication by mistake. The nurse admitted she was in a hurry and didn't even bother to ask his name or date of birth or even look at his armband. Dad never questioned the nurse because he trusted she knew what she was doing. I'm glad Dad's fine now, but it was a really scary situation.